Question 1. A nurse is preparing to administer IV potassium. What is the safest action? A. Administering potassium, IV push for rapid correction. B. Diluting potassium in a prescribed IV fluid and infusing with a pump. C. Giving potassium IM when IV access is limited. D. Hanging potassium without checking renal function. Answer. B. Diluting potassium in a prescribed IV fluid and infusing with a pump. Rationale. Potassium must always be diluted and infused via pump to avoid fatal dysrhythmias. Question 2. A patient on warfarin reports dark, tarry stools. What should the nurse do first? A. Document the finding and reassess in 4 hours. B. Encourage increased fluid intake. C. Notify the provider immediately. D. Administer the next scheduled dose. Answer. C. Notify the provider immediately. Rationale. Dark stools indicate possible GI bleeding, requiring urgent provider notification. Question 3. A high-alert medication must be administered. What is the priority action? A. Prepare the medication independently. B. Ask another nurse for a second verification. C. Delegate preparation to a UAP. D. Store the medication unlocked for easier access. Answer. B. Ask another nurse for a second verification. Rationale. High-alert medications require independent double checks for safety. Question 4. A patient with renal impairment has a drug order for a renally excreted medication. What should the nurse do first? A. Administer the full dose as ordered. B. Assess the patient's creatinine level. C. Hold the medication without consulting the provider. D. Give the medication with extra fluids. Answer. B. Assess the patient's creatinine level. Rationale. Renal function must be assessed to prevent drug accumulation and toxicity. Question 5. A nurse sees an unfamiliar medication on the march. What is the correct first action? A. Administer it to avoid delay. B. Ask another nurse what the medication is. C. Look up the medication in a reliable reference. D. Skip the medication until next shift. Answer. C. Look up the medication in a reliable reference. Rationale. Verifying information ensures safe administration and prevents error. Question 6. Which patient requires priority assessment before receiving a beta blocker? A. A patient with mild ankle edema. B. A patient with a heart rate of 54 per minute. C. A patient with mild nausea. D. A patient with a blood pressure of 128/72. Answer. B. A patient with a heart rate of 54 per minute. Rationale. Beta blockers reduce heart rate. Bradycardia may require holding the dose. Question 7. A nurse must delegate tasks related to medication administration. Which task is appropriate for a UAP? A. Administering oral medications. B. Setting up an insulin drip. C. Reporting vital signs after medication administration. D. Administering PRN pain medications. Answer. C. Reporting vital signs after medication administration. Rationale. UAPs can report data but cannot administer medications. Question 8. A patient taking digoxin reports nausea and blurred vision. What should the nurse do? A. Give the dose as ordered. B. Hold the dose and notify the provider. C. Give an antiemetic first. D. Increase the IV fluid rate. Answer. B. Hold the dose and notify the provider. Rationale. These are signs of digoxin toxicity. The medication must be held. Question 9. Before giving a loop diuretic, what is the nurse's priority? A. Check the urine pH. B. Assess the potassium level. C. Give with a high sodium meal. D. Administer at bedtime. Answer. B. Assess the potassium level. Rationale. Loop diuretics may cause hypokalemia, increasing risk for dysrhythmias. Question 10. A nurse catches a medication dose calculation error before administration. What is the appropriate action? A. Document the dose as given to avoid scrutiny. B. Report the near miss according to facility policy. C. Ignore the error since it was not administered. D. Ask another nurse to keep it confidential. Answer. B. Report the near miss according to facility policy. Rationale. Reporting near misses strengthens system-wide safety processes. Question 11. A patient asks why they cannot drink grapefruit juice with their medication. Best response? A. It deactivates the medication. B. It causes stomach ulcers. C. It changes how your body absorbs the drug. D. It increases your blood sugar. Answer. C. It changes how your body absorbs the drug. Rationale. Grapefruit interferes with CYP450 enzymes, altering drug absorption. Question 12. Which patient should receive their medication first? A. A stable patient awaiting vitamins. B. A patient requesting pain medication for 6 out of 10 pain. C. A patient due for time-sensitive insulin. D. A patient receiving antibiotics early for convenience. Answer. C. A patient due for time-sensitive insulin. Rationale. Insulin has strict administration timing related to glucose control and meals. Question 13. A patient prescribed morphine has respirations of 8 per minute. What should the nurse do? A. Administer the morphine as ordered. B. Hold the medication and notify the provider. C. Give an antiemetic to prevent nausea. D. Administer a bronchodilator first. Answer. B. Hold the medication and notify the provider. Rationale. Respiratory depression is a contraindication to opioid administration. Question 14. A nurse preparing to give IV antibiotics notices the patient has a documented penicillin allergy. What is the priority action? A. Administer slowly to reduce risk. B. Ask the patient if they still have the allergy. C. Verify the order and notify the provider. D. Document it, but give the medication. Answer. C. Verify the order and notify the provider. Rationale. Cross-reactivity can occur. Provider must reassess and modify the order. Question 15. A patient complains of muscle pain while taking a statin. What is the nurse's first action? A. Encourage more exercise. B. Tell the patient it is normal. C. Assess for rhabdomyolysis symptoms. D. Increase dietary protein. Answer. C. Assess for rhabdomyolysis symptoms. Rationale. Muscle pain may indicate statin-induced muscle breakdown requiring urgent evaluation. Question 16. A nurse must administer insulin, but the MAR dose seems unusually high. What should the nurse do? A. Give the dose as written. B. Ask a UAP to verify the dose. C. Call the pharmacy or provider to clarify. D. Wait until the next shift to decide. Answer. C. Call the pharmacy or provider to clarify. Rationale. Unusual or unsafe doses require clarification to prevent harm. Question 17. A patient receiving heparin has an APTT twice the therapeutic range. What should the nurse do first? A. Administer the next dose. B. Notify the provider and hold heparin. C. Increase IV fluids. D. Give vitamin K. Answer. B. Notify the provider and hold heparin. Rationale. Elevated APTT increases bleeding risk. Heparin must be held. Question 18. A nurse gives a medication, but later realizes it was given to the wrong patient. What is the first action? A. Complete an incident report immediately. B. Assess the patient's current condition. C. Notify the pharmacy first. D. Tell no one since the patient is stable. Answer. B. Assess the patient's current condition. Rationale. The nurse must first assess for harm before further actions. Question 19. A patient states, "This pill looks different from what I take at home." What should the nurse do? A. Tell the patient medications vary by manufacturer. B. Ask the patient to take it anyway. C. Recheck the provider order and drug label. D. Document refusal and discard the medication. Answer. C. Recheck the provider order and drug label. Rationale. Medication discrepancies must be verified before administration. Question 20. A provider orders 5x the normal dose of a high-risk medication. What should the nurse do? A. Administer the dose because the provider prescribed it. B. Ask another nurse if the dose looks correct. C. Hold the dose and clarify with the provider. D. Split the dose into smaller amounts. Answer. C. Hold the dose and clarify with the provider. Rationale. Unsafe or unusually high doses require immediate clarification to protect the patient. Question 21. A septic patient on norepinephrine has a new order for a beta blocker. What should the nurse do first? A. Administer both medications as ordered. B. Clarify the order with the provider immediately. C. Reduce the norepinephrine dose before giving the beta blocker. D. Increase IV fluid rate before giving the dose. Answer. B. Clarify the order with the provider immediately. Rationale. Beta blockers blunt compensatory responses during septic shock and may cause cardiovascular collapse. The order must be clarified. Question 22. A patient on IV heparin, aspirin, and warfarin develops mild gum bleeding. Priority action? A. Document findings as expected. B. Stop aspirin only. C. Assess APTT and INR immediately. D. Flush the line with heparin. Answer. C. Assess APTT and INR immediately. Rationale. Triple therapy significantly increases bleeding risk. Lab assessment guides urgent safety decisions. Question 23. A nurse prepares to administer vancomycin and piperacillin tazobactam through the same IV line. Priority action? A. Administer both medications sequentially. B. Check compatibility before administration. C. Flush with 10 milliliters NS after both infusions. D. Give them rapidly to reduce infusion time. Answer. B. Check compatibility before administration. Rationale. These medications often require separate lines due to incompatibility. Checking prevents precipitation and harm. Question 24. A patient with bradycardia is receiving digoxin and just started on diltiazem. What is the nurse's immediate action? A. Hold the diltiazem only. B. Assess the apical pulse and ECG rhythm. C. Administer both drugs to maintain rate control. D. Give atropine preemptively. Answer. B. Assess the apical pulse and ECG rhythm. Rationale. Combining AV node blocking drugs can cause severe conduction blocks. Assessment is required before administration. Question 25. A chemotherapy patient on ondansetron develops new prolonged QT on telemetry. What should the nurse do first? A. Discontinue ondansetron and notify provider. B. Lower the bed and activate fall precautions. C. Administer PRN antiemetic instead. D. Increase IV fluids to correct perfusion. Answer. A. Discontinue ondansetron and notify provider. Rationale. QT prolongation increases risk of torsades. The causative drug must be stopped immediately. Question 26. A patient with hyperkalemia is ordered spironolactone. What should the nurse do? A. Administer the dose as prescribed. B. Hold the dose and notify the provider. C. Give a potassium-rich snack. D. Administer additional IV fluids. Answer. B. Hold the dose and notify the provider. Rationale. Spironolactone is potassium-sparing. Giving it during hyperkalemia can cause lethal arrhythmias. Question 27. A patient receives IV hydromorphone and now has pinpoint pupils and a respiratory rate of 6 per minute. First action: A. Notify the provider. B. Administer naloxone per protocol. C. Prepare for intubation before giving medications. D. Increase IV fluids. Answer: B. Administer naloxone per protocol. Rationale: naloxone is life-saving in opioid-induced respiratory depression. Reversal is the immediate priority. Question 28. A nurse prepares to give metformin to a patient scheduled for contrast CT in 45 minutes. What should the nurse do? A. Administer metformin as ordered. B. Hold metformin and notify the provider. C. Give a dose after the procedure. D. Reduce the dose by half. Answer: B. Hold metformin and notify the provider. Rationale: metformin must be held before contrast procedures due to risk of lactic acidosis. Question 29. A patient on multiple QT prolonging drugs develops frequent PVCs. Priority action: A. Administer magnesium sulfate immediately. B. Continue monitoring for 1 hour. C. Discontinue all QT prolonging medications. D. Increase oral fluid intake. Answer: C. Discontinue all QT prolonging medications. Rationale: removing offending medications prevents progression to torsades de pointes. Question 30. A nurse is preparing to administer NPH and regular insulin in one syringe. What must the nurse do first? A. Draw up NPH first, then regular insulin. B. Draw up regular insulin first, then NPH. C. Mix both vials vigorously to ensure distribution. D. Ask pharmacy to prepare the combination. Answer: B. Draw up regular insulin first, then NPH. Rationale: clear to cloudy prevents contamination of short-acting insulin. Question 31. A patient on digoxin is receiving furosemide and shows confusion and irregular rhythm. First action: A. Give a next digoxin dose early. B. Assess potassium level immediately. C. Stop furosemide only. D. Replace magnesium first. Answer: B. Assess potassium level immediately. Rationale: hypokalemia from diuretics increases digoxin toxicity. Potassium must be assessed urgently. Question 32. A nurse receives a verbal order for a high-alert medication during a noisy code situation. What should the nurse do? A. Accept and give it immediately. B. Repeat the order back verbatim before administering. C. Ask a UAP to verify the medication name. D. Write it down and confirm later. Answer: B. Repeat the order back verbatim before administering. Rationale: read back verification prevents errors, especially with high-alert drugs. Question 33. A patient on an amiodarone drip develops a heart rate of 38 per minute. Priority action: A. Decrease the infusion rate. B. Stop the amiodarone and notify provider. C. Administer PRN atropine before stopping. D. Increase oxygen to 15-liter via non-rebreather. Answer: B. Stop the amiodarone and notify provider. Rationale: severe bradycardia is a known adverse effect. Stopping the drug prevents further conduction slowing. Question 34. A nurse is preparing to give IV phenytoin. What is the safest action? A. Give it rapidly to prevent seizures. B. Dilute it in normal saline and use a filter. C. Combine it with dextrose for better absorption. D. Administer IM if the patient is uncooperative. Answer: B. Dilute it in normal saline and use a filter. Rationale: phenytoin precipitates in dextrose and must be filtered to prevent crystallization. Question 35. A patient receiving IV nitroprusside shows sudden confusion and tachycardia. What should the nurse do? A. Increase the infusion rate. B. Assess for cyanide toxicity and stop the infusion. C. Administer oxygen at 2 liters per minute. D. Give PRN antihypertensive instead. Answer. B. Assess for cyanide toxicity and stop the infusion. Rationale. Nitroprusside may cause cyanide poisoning. Early recognition is essential. Question 36. A patient receiving TPN suddenly becomes diaphoretic and shaky. What should the nurse do first? A. Stop the TPN immediately. B. Assess blood glucose. C. Give 50% dextrose. D. Reduce the infusion rate by half. Answer. B. Assess blood glucose. Rationale. Sudden symptoms may indicate hypoglycemia. Glucose must be checked before intervening. Question 37. A patient taking MAOIs wants to take over-the-counter cold medicine. What is the nurse's safest response? A. All cold medicines are safe to use. B. Take the medication only once daily. C. Avoid OTC cold medicines until you discuss with your provider. D. Choose any brand that is alcohol-free. Answer. C. Avoid OTC cold medicines until you discuss with your provider. Rationale. Many cold medications contain sympathomimetics that cause hypertensive crisis when combined with MAOIs. Question 38. A nurse receives an order to titrate a vasoactive drip but notices the pump malfunctioning. What should the nurse do? A. Titrate manually using drip rate calculations. B. Replace the pump immediately before titrating. C. Ask a UAP to monitor the drip rate closely. D. Continue using the pump with close monitoring. Answer. B. Replace the pump immediately before titrating. Rationale. Vasoactive drips require precise dosing. A malfunctioning pump is unsafe. Question 39. A post-op patient is on PCA morphine. The UAP reports the patient is hard to wake. What should the nurse do first? A. Instruct the UAP to keep stimulating the patient. B. Assess respiratory rate and oxygen saturation immediately. C. Pause the PCA and document. D. Call the provider immediately without assessing. Answer. B. Assess respiratory rate and oxygen saturation immediately. Rationale. PCA opioids can cause respiratory depression. Assessment is the immediate priority. Question 40. A provider orders IV metoprolol for a patient with acute decompensated heart failure. What should the nurse do? A. Administer the dose immediately. B. Clarify the order with the provider before giving. C. Give a fluid bolus first. D. Give half the dose. Answer. B. Clarify the order with the provider before giving. Rationale. IV beta blockers can worsen acute HF. Clarification protects patient safety. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.